To you all, AsSalama'laikum. This is Omar Abdul Malik, physician associate, health educator, and endurance athlete. So today is Monday, and it is the what is this? January 17th. I get my days mixed up sometimes because I cover night shift. And it throws off my circadian rhythms and time awareness also sometimes. But today is Martin Luther King Day, so I wanted to talk to you guys briefly about some of my thoughts about the holiday of Dr. Martin Luther King Jr. So he is often attributed to trying to fight for rights for black folks in America, but he also was a very strong advocate for the rights of working class and poor people, irrespective of their race. So this is, I think, one of the things that is often not spoken about him. One of the things that he often touted was equality in healthcare, and it's I don't know if we're ever going to have that. I don't know if there's a panacea for everybody in this country getting good quality healthcare. I have worked at nonprofit organizations, clinics, and even hospitals where we've provided, my colleagues and I have provided free health care for people who could not afford it. One clinic I even worked at, we took up kind of a collection, and we would help pay for people's medications, because he said, well, people should be able to pay for medications if they have things like Medicare and Medicaid. But if you are an elderly person on multiple medications, that dollar a prescription for a copay adds up if you're on multiple pills. And you throw in hypertension, diabetes, hyperlipidemia, maybe COPD, arthritic pain. Well, that could be as many as 5 to 10 different prescriptions. That's $10. That might not be a lot to some people, but to somebody that is a poor person, in particular our elderly, that's quite costly every month. And as many of you all know, we've got this gray wave approaching in this country, in America anyway, where we're going to have a very significant population of elderly. And it's very well known that most of our poor are usually tend to be in the elderly population. But anyway, I don't know if there is an answer to our disparities in healthcare. And we were talking about that when I was in school more than 20 years ago. And I was a nursing student more than 30 years ago, back in 1990. We were talking about health disparities. But it seems like the gap has gotten even wider. But and this COVID-19 pandemic has shed more light on that. Irrespective of what side you're on, whether you're a Republican or a Democrat or an independent or whatever, whether you're an anti-vaxxer or a vaxxer or a masker or an anti-masker, everybody's suffering to some degree. I'd like, we thought we were going to see an end to it, but this Omicron variant has kind of extended things further than any of us would like. But I don't know what we can do about solving disparities in healthcare. Racial disparities, but in particular socioeconomic disparities. One of my fields is also health education. So my doctorate is in health education. I'm very passionate about that. I use my medical knowledge as a PA in my particular field of practice, which is kind of adult medicine, to try to advocate for people to at least modify their lifestyles. So things that you can do something about. I can't do anything about my race or my gender. I'm a black male, urban dwelling. There's well, that's a modifiable risk factor. But things like not smoking, not doing drugs, living an active lifestyle, so trying to get exercise as much as possible, not controlling my stress level. Those are some things that I can do something about. And I try to educate folks who may not have the best of insurance or even have any type of insurance coverage. At least try to control yourself to the greatest degree that you can, um, to live an optimal quality of life. But that's it for now. Uh, you know, I encourage myself first, but also encourage you guys to do what you can to be advocates for overcoming health disparities, starting with yourself, me starting with myself. And I wish you guys the best of success in your positive endeavors. If you're interested in being a physician associate or a health educator like me, you can feel free to reach out to me. I will advise you to the best of my ability. I'm also an erstwhile professor and a admissions committee member, so I can give you tips on personal statements and how to interview. That's it for now. I'll tell you, I've been a PA for a little more than 20 years, and I started out in nursing um, more than 30 years ago, back in 1990, and it's been a great career being in the healthcare field. But I wish you guys the best of success in your positive endeavors, and reach out to me if you want to, and subscribe if you feel like it. Take care. Peace.